So now about the placenta. So what is placenta? Is the intimate organ in between the mother and the fetus. That function is nutritive, excretory, and exchange, and other hepatic, renal, all functions depends on this placenta. So from this knowledge you understand that placenta is formed from the maternal tissue and also the fetal tissue. Fetal components known as caudative fundus and maternal components known as decidua basalis. Okay, now what is embryogenesis? Embryo is the period of the fetus up to 8 weeks. Okay? From fertilization up to 8 weeks, it is the the embryo. Now I need to discuss how it is formed. It should be formed from outer cell mass or inner cell mass? Inner cell mass. So inner cell mass is, there is ectoderm and mesoderm. Inner cell mass, at first there is bilaminar germ layer. Okay? Can you memorize? Bilaminar germ layer is at first ectoderm and endoderm, right? Ectoderm and endoderm. In between, then another layer is formed, that is mesoderm. That is called trilaminar. So from this structure, yes, trigeminal. Okay, then so bilaminar, trigeminal. Then from this structure, all the fetal pole, proper embryo is formed now. So at the 3rd weeks, it is up to 8 weeks, and there is formation of the, the 4 weeks, then 6 weeks, 8 weeks. Can we understand this fetal period, embryonic period? Of course, we can understand by the ultrasonogram. So fetal pole is crown drum length. You know the crown drum length? Okay, now let us go again in the bilaminar disc. This bilaminar disc, ultimately there is a folding of the bilaminar disc, head fold, tail fold, cardiac activity, these are formed. And in the 3rd week there is primitive streak, and the nervous system is from the primitive streak. Anyway, just the up to when cardiac function starts. Cardiac 5 weeks. And fetal, we can understand by ultrasonogram the fetal pole at the 5 weeks. At 5 weeks, mainly by the TBS, transvaginal ultrasonogram. Okay? You heard the name TBS, transvaginal ultrasonogram. So earlier ultrasonogram is at 1st weeks. By transvaginal ultrasonogram, we can dictate the fetal pole. Now cardiac activity starts, we can understand later. And another is beta SCJ. Okay? So embryo and then fetal period. Embryo is 8 weeks, and after that is the fetal period. Now again I come to the placenta. The placental type, placental function, and abnormalities of the placenta, amnion and umbilical cord. That is important. Amnion, umbilical cord. All are found extraembryonic mesoderm. Okay, now how amnion is formed? You know, everything, what is normal and what is abnormal. Suppose how you know any person. Any person have some what is height, weight, shape, color, function, voice, like this. We can understand that he is that person. So placenta, how can we understand it is normal and abnormal? So it has definite size, shape, position and function. So what is so it is a growing stage. At term, placenta is how many weight? Near 500 gram. And shape, discoid shape. And that is position where it is usually near the fundus, anterior, posterior. Okay? And abnormal, if there is changes in the size and shape. Small, it may be small placenta, it may be other circumvallate placenta, the succinturate lobe of the placenta, bipartite, tripartite, so many type of placenta. All these type of placenta associated with abnormal outcome, like antepartum hemorrhage, retained bits of the placenta, fetal, bad fetal outcome, abortion. These are related with the abnormal shape and position of the placenta. Okay? Then we can come to the, the position, abnormal position. If placenta usually placed in the fundus, if it is positioned in the lower uterine segment, what is called it is? Very good, placenta previa. If placenta is separated, early separation, then it is called abruptio placenta. Okay, function is nicely and clearly written in the books. You can go through books. That is no problem. And now come to the amnion. What is amnion? Amnion is a very transparent, tough membrane that surrounds the fetus. How it is formed? It comes through the ectoderm or endodermal epithelium. Endodermal, extension of the endodermal epithelium, and just near surrounding the blastocyst, and form ultimately along with the extraembryonic coelom, all are mashed together and form the amnion. And amnion is so important for you, how it is formed and the function of the amnion. What function? What do you think? Functions? Functions? It is important to give nutrition. Suppose at first, at the beginning, yolk sac supplies the food to the fetus. After that, amnion. And amnion, who regulates the amnion? Who regulates the amnion? Amnion, suppose fetus, surrounding fluid, placenta, arbitrary, all are arbitrary. Suppose placenta, fetus, and then amniotic fluid. Okay? Amniotic fluid. So you can imagine how it is formed. From where the fluid comes. Transitive fluid comes through the placental vessels. From placental, and there is umbilical cord. Through the umbilical cord there is structure. What structure of the umbilical cord? To one vein to artery. From the structure of the umbilical cord, the fluid also comes to the amnion. And there is fetal secretion, excretion, urine formation, all also the components of amniotic fluid. So you can imagine how the amniotic fluid is formed. Number one, placental bed. So, that is transudative fluid from the placenta, and then umbilical blood vessels, and that is another is more components. What is more component? Fetal urine, alimentary tract, secretion, pulmonary secretion, all stool means meconium, that is. Anyway, that is alimentary secretion. You can tell better alimentary secretion, renal excretion, and other skin shedding, also transitive fluid from the fetal skin, and umbilical vessels. All these form the amniotic fluid. Okay? All this form the amniotic fluid. So amniotic fluid, the amount of the amniotic fluid constant or variable? It is variable on the duration of the pregnancy. At term it is about 800 ml. 800 ml, huh? At term. At term means what is term pregnancy? That is 37 is complete. 38 to 42 is 42 or 41 weeks, that is called at term pregnancy. That is 800 ml. If less, then it is called oligohydramnios. If more than 1.5 liter, then it is called polyhydramnios. Okay, so that is amniotic fluid. Main purpose is to give nutritive and then the fetal movement, easy fetal movement. Fetal can easily move within the amniotic fluid. So amniotic fluid during pregnancy, during labor. The function during pregnancy, during two different. During pregnancy, it support and just cushion like support, and nutritive also, and exchange of with the mother, all things in the fluid, and other is what others? Acid-base balance and temperature maintenance, all are depends on the amniotic fluid. Okay? And is there any possibility of infection? Amnion? Yes. Feta, even if the fetus in the mother, but there is a chapter fetal pathology. Fetus also be infected. Placenta also be infected. Chorion is also infected. Amnion is also infected. So amnion, if infection, what is called? Amnionitis. And if chorion and amnion is infected, then chorioamnionitis. Is it good? Always bad. So congenital infection, that is a term. You know the toxoplasmosis, cytomegalovirus, streptococcus, and that is torch. Torch plus different bacteria causes infection. And infection, chorioamnionitis, ultimately it is membrane is ruptured. Ruptured membrane, what is called? If membrane is ruptured membrane, it may be premature or at term, but naturally during labor it is ruptured. Okay, and so as it is the fluid, it has definite. There is definite color, definite composition, and color is changed during the different pathological condition. Suppose RS incompatibility, the color is changed. And suppose post maturity, color is changed. If the fetus is intrauterine death, the color is changed. So sometimes saffron color in post maturity, and if IUD, there is color totally meconium stained, or it depends on the different pathological causes. So color is changed on the basics of the pathology. So you should know about the amnion. So there is a circulating in between the mother and the fetus. Always the amniotic fluid is changeable. Not daily there is a circulation. About how many times? So many times there is a circulation with the circulation of the fluid, the turnover, due to maternal and fetal circulation, turnover. So sometimes there is a rupture membrane. That means the it already gone. Not like that. It is again formed. So we give assurance to the mother. You take rest. You take plenty fluid, and sometimes with oral hydration, you take more fluid. Again, fluid will come to you. Okay. So not to be worried sometimes.